Let's read this paper together. The title of the study is Remote Ischemic Conditioning Reduces Adverse Events in Patients with Acute Ischemic Stroke Complicating Acute Myocardial Infarction, a randomized controlled trial. Hello, everyone. Today, I want to share with you the latest medical research. This study investigates a method called remote ischemic conditioning, abbreviated as RIC, to see if it can help patients who suffer from both stroke and heart attack at the same time. Sounds complicated, right? Don't worry, I'll explain it in simple terms. What are stroke and heart attack? A stroke happens when a blood vessel in the brain suddenly gets blocked, causing brain cells to be deprived of oxygen and nutrients. This can lead to weakness in limbs, slurred speech, or even loss of consciousness. A heart attack occurs when a blood vessel supplying the heart muscle is suddenly blocked, causing heart tissue to be damaged or die. Symptoms include chest pain, cold sweats, and in severe cases, sudden death. Both conditions are emergencies caused by blocked blood vessels and often share common risk factors such as high blood pressure, diabetes, high cholesterol, and smoking. What's more concerning is that some patients experience both stroke and heart attack simultaneously, which greatly increases the risk of death and makes treatment very challenging. So what exactly is RIC? It's actually a simple procedure, using a blood pressure cuff to temporarily block blood flow in the arm, causing brief local ischemia, lack of blood flow, then releasing it to restore circulation. This process triggers a protective response in the body, essentially signaling the brain and heart to get ready for possible ischemic events. This protective effect may help reduce damage to both the brain and heart. How was the study conducted? A clinical trial was carried out at Xuanwu Hospital in Beijing, China. They recruited 80 patients who had both a stroke and a heart attack, dividing them into two groups. One group performed RIC twice daily for 2 consecutive weeks. The other group underwent a sham RIC, where the blood pressure cuff was inflated lightly, not causing actual ischemia. All patients continued to receive standard medication treatments, such as antiplatelet drugs and cholesterol-lowering medications. Study results. After 3 months, the study found major cardiovascular and cerebrovascular events, death, recurrent heart attack, recurrent stroke, etc., occurred in only 29.7% of the RIC group, compared to 52.5% in the sham RIC group. The mortality rate was 16.2% in the RIC group versus 37.5% in the sham group. Regarding the ability to live independently, misses less than or equal to 2. 45.9% of patients in the RIC group recovered to self-care status, while only 15% did so in the sham group. In short, patients who underwent RIC had lower mortality rates and better quality of life. Significance of the study. What does this mean? RIC is a simple, inexpensive, and non-invasive method that can be done using just a blood pressure cuff. For patients with both stroke and heart attack, RIC may reduce mortality, decrease subsequent complications, and aid recovery. However, it's important to note that this was a single-center study with a relatively small sample size, so larger clinical trials are needed to confirm these findings. Therefore, RIC appears to be a promising adjunctive treatment. But remember, prevention remains the most important. Control blood pressure, blood sugar, and cholesterol levels. Quit smoking and limit alcohol consumption. Exercise regularly and maintain a healthy diet. These are the fundamental ways to prevent stroke and heart attack. All right, that's all for today's sharing. This study shows us that sometimes simple methods can bring significant benefits. Hopefully, everyone can take good care of their blood vessels and stay away from stroke and heart attack. Do people truly believe that healthy medicine and RIC can promote wellness? Hurry and purchase a healthy RIC sphygmomanometer to enhance your health every day. Don't forget to scan the QR code. Thank you all for watching. I am Dr. Andrew Shu Lee. Until next time.